out by just interviewing you and saying, hello, Dr. Vitale. If you could give us a little bit of your background, your title, where you are, and the name of the conference that you're with.
Great. Hello, I'm Dr. Michael Vitale. I'm the Vice Chief of Orthopedics for Quality and Safety here at Columbia University Medical Center. I'm also the founder for the Project for Safety in Spine Surgery. This is the nonprofit that, among many other things, hosts the Summit for Safety in Spine Surgery, the next of which is coming up in May.
That's great. And I'm so delighted to be with you here today, Dr. Vitale. And it's really amazing to work with other nonprofits that are focused on maximizing patient outcomes and really looking at how do we deliver the best possible care to patients. National Spine Health Foundation is here to sort of tell the good news in spinal health care to the public in an authoritative and unbiased way, so that we're telling the real the real good news and not again not biasing what we're saying by being dictated by what different companies or other interests might be in how to get real accurate information so that patients can make the best informed decisions for their spine care. So tell us a little bit about what's going to happen at the summit.
Well, this is the 11th Summit for Safety in Spine Surgery, and this has been a great journey. Almost from the very inception, 11 years ago, the summit has attracted a standing room-only crowd. In fact, many years we have to simulcast to an adjacent room because of our inability to seat everyone. There's also virtual options, and we're increasingly having people Zoom into our meeting. This is really an opportunity for people to come together and share best practices, to listen to some of the learnings of thought leaders around the world who are at the state of the art around techniques, tactics, strategies to constantly improve the safety of spine surgery. We've come a long way, and we are able to deliver better outcomes than ever in an even more safe manner than ever to our patients. But we're all on this learning journey, and there's still so much to be done. By coming to the Summit for Safety in Spine Surgery, by listening and learning and interacting from leaders in the field, and by starting to understand the importance of teamwork, culture, decreasing variability, standardization, we'll all emerge a little bit better to provide the best possible care for patients.
Yeah, that is awesome. And we are really excited to be partnering with you to begin to help translate that very technical scientific meeting that you will be chairing and leading so that the general public can understand key takeaways from the meeting. And I'm excited to participate at the summit this year to bring that patient voice, which is so important because that's what we're all talking about is patients at the end of the day. There have been so many revolutions in spinal healthcare, minimally invasive surgery, robotic surgery, motion preservations, just to name a few. And with this rapidly changing landscape in spine, it's so important for thought leaders to come together to share, as you said, those best practices. What do you think are going to be some of the key takeaways that we'll be able to help the public understand about the good news in safety in spine treatments?
I don't want to give away all the highlights of the meeting coming. But every year, the meeting has a specific theme, and oftentimes we focus on multiple things. There are always lessons learned around the critical role of dedicated teams, team building, and culture in and out of the operating room. And you'll certainly hear a lot of that on May 30th from leaders around the world. There'll also be a special focus on ways that we can improve, standardize, and optimize intraoperative neuromonitoring. This has been one of the true revolutions in safety in spine surgery, and we're still continue to learn about ways to optimize this. Finally, there'll be a real emphasis on enabling technologies. As you alluded to, Rita, enabling technologies have the promise to make spine surgery safer, but we need to be thoughtful about how we teach these technologies, how we adopt them, and how we optimize them. In fact, last year, a key output, a key work product of the meeting was a best practice guideline around robotic assisted spine surgery, a guideline that was quickly published, promulgated, disseminated, and is already changing care by standardizing and optimizing how we actually execute our robotic assisted spine surgery. So there's lots more that you'll learn on May 30th, but those are some of the key takeaways.
That is so exciting, Dr. Vitale. And, we again are so honored to get to work with thought leaders like you. We call you and the surgeons who are going to be gathering at that conference healthcare heroes, because you're going above and beyond your practice to volunteer your time to come together at these meetings to really share your best practices, your clinical experiences, and to create these guidelines that set standards that patients can feel comfortable knowing that there are national standards. They can ask their doctor about it. And it's really exciting to be able to talk about that. You all have designated April as Safety in Spine Month. What do you hope to achieve by making that designation?
As I said, there's a number of work efforts of the Project for Safety in Spine Surgery. One is around creating best practice guidelines. This year, we are creating the 11th best practice guideline around various aspects of safety in spine surgery, and all are available, as well as lots of other information, on our newly updated website, the Project for Safety in Spine Surgery. I'd really encourage you to take a look at the Project for Safety in Spine Surgery to learn a lot more about all of these things that we're talking about. But one of the other outputs is widening the acknowledgement, widening the understanding, widening the recognition of the common, not just opportunity, but responsibility that we all share to improve constantly the safety of the spine surgery that we perform, whether we're pediatric spine surgeons like myself, adult spine surgeons, neurosurgeons, orthopedic surgeons, or various parts of the team, because we really need to start thinking about the care of patients as a team sport that begins way before the cutting part of the surgery and ends way after the closure. That's the way that we really get to improve care, through a broadly based expert teams working together, looking at the patient holistically way before the surgery actually starts and ends.
Yeah, that's so exciting to think about. We talk about the patient journey, and that patient journey starts, right at the beginning of understanding that there might be a problem, that it might be able to be fixed with a surgery, that a surgery is going to take care of it, having the surgery, and then the patient continuing on the recovery and that rehab journey. And it really is a journey. And so many of the surgeons who we get to work with say, we do our part as surgeons, but the patients have to do their part too. And so much of what we do here in the National Spine Health Foundation is provide tools so that patients can be their own best advocate as they go down this journey and work in partnership with their healthcare providers, team, surgeon, and all involved in helping them get back to their lives, right?
And that's what this is really all about. I couldn't agree
Yeah.
more. It's really a pleasure to work with the National Spine Health Foundation to this end. And I'm really looking forward to spending some time together on what will be a great panel discussion.